Hi guys, welcome to our channel Physio Vibes Anatomy. Today we are going to see about the deltoid muscle. This is a triangular muscle which is present in our shoulder region and it forms the rounded contour of our shoulder. So in this video we'll be discussing about this muscle, its anatomy and function. So let's start. So this is the outline. We'll be seeing the introduction of this muscle, origin and insertion, innervation, action of this muscle, and finally the clinical anatomy. So let's see the definition of this muscle. It is a triangular large muscle which is present in our shoulder region. You can see triangular muscle, and it is the superficial muscle. Hence, it forms the rounded contour of the shoulder. Then the third point is it resembles the symbol delta. This muscle deltoid, it resembles the Greek letter delta, which is, so you can see here the deltoid will be like this. So it resembles the delta symbol, so the name of this muscle is deltoid muscle. And it has anterior, posterior and middle fibers. So we'll be seeing in this video. Now let's see the origin of this muscle. Actually in the beginning I said it has three fibers: anterior fibers, middle fibers and posterior fibers. Here you can see in this picture, this is the clavicle bone, acromion process. So this is the spine of scapula. This is posterior side, this is anterior side. So we are seeing from the side view. Anterior fibers will be coming from the lateral part of the clavicle. From the anterior surface of clavicle, anterior fibers will be coming. So the middle fibers will be coming from the acromion, the lateral border of acromion, and the posterior fibers will be coming from the crest of spine. Now let's see the insertion of this muscle. So as I said, it originates from three bony projections: clavicle and acromion and spine. So it forms joints together and inserts into the deltoid tuberosity, which is going to be present in the humerus bone. In the middle of the humerus there is a deltoid tuberosity, and in this tuberosity the deltoid muscle is going to get inserted. So guys, this is our model. So today I'm going to show you the location of the deltoid muscle here in this model. So let's see. So now I'm going to show you how the deltoid muscle is located here. So this is what the deltoid muscle's location. Here the deltoid muscle is present as anterior fibers, middle fibers, and in the back you will be having the posterior fibers. So now we'll see, this is our clavicle. As you all know, clavicle is a subcutaneous bone which we can palpate easily and feel it, right? So from the lateral part of the clavicle, the anterior surface, the anterior fibers of the deltoid originates and comes like this. Then here you will be having the acromion. Acromion will be articulating with the clavicle, as we know. So here from the acromion, the lateral border of acromion, the middle fibers of deltoid comes like this. So anterior fibers will be coming like this and middle fibers will be coming like this. Now in the posterior view, I'll show you the posterior fibers. So now from here the posterior fibers will be coming. This is our scapula bone. This is also, this part of the scapula is subcutaneous. You can feel the scapula here. So here you will be having the spine of scapula, and from the lower lip of the crest of spine, the posterior fibers coming like this. It will come like this, like the anterior comes, middle, and the posterior will be also coming. Now for your convenience, I just marked the presence of the muscle. Like here the muscle will be present like this. You can see this is the deltoid muscle. it will be like this. So anterior fibers, you can see anterior fibers coming from clavicle, middle fibers coming from the acromion, and you can just see the posterior fibers coming from the spine of scapula. Now here the muscle originates from these three areas. Three fibers merge and inserts in the deltoid tuberosity. I mark like an into symbol here. This is what this place in the humerus is called the deltoid tuberosity D. So the muscle originates from these three bony projections and inserts in the deltoid tuberosity of the humerus. And this muscle deltoid is innervated by the axillary nerve. That is, the nerve which supplies the deltoid muscle is the axillary nerve, which is coming from the brachial plexus and having the root values C5 and C6. Now we are going to see the action of this deltoid muscle. These are all the overall movements which is done by this muscle: flexion, internal rotation, extension, external rotation, and abduction. So let's see in detail. The first two movements, flexion and internal rotation, are done by the anterior fibers of the deltoid. So this anterior fibers, which is coming from the clavicle, flexes the arm and internally rotates or medially rotates the shoulder joint. The next thing is extension and external rotation. These two movements are done by the posterior fibers of deltoid. So this posterior fibers coming from the spine of scapula externally rotates and extends the arm at the shoulder joint. So the final movement is abduction. The middle fibers of the acromion, which is a very important in doing the abduction. So the beginning of abduction, 0 to 90 degree, along with supraspinatus, it does the abduction movement in our shoulder joint. Let's see the clinical significance of this muscle. This deltoid muscle is often the selection for the intramuscular injections in the upper limb. The injections should be given into the middle of this muscle to avoid the damage to the axillary nerve which is present behind this muscle. The next thing is axillary nerve damage. So this is the nerve which supplies to this deltoid muscle. So if this nerve is getting damaged, the deltoid muscle is going to get paralyzed and the rounded contour of our shoulder will get lost, and the muscle will lose its ability to abduct the arm from 0 to 90 degree. So guys, this is the deltoid muscle which we have seen today. Hope you guys understood. We'll meet in the next video with the next topic. God bless you.